Hello everybody, I am Dr. Amit B, consultant urologist working at Atreum Hospital, RR. Today we will be talking about one condition, retention of urine. So what happens in this condition? Patient tells that they are unable to pass urine from the past 4 to 6 hours. There could be pain in the lower abdomen, distension or swelling of the lower abdomen, and sometimes there could be passage of only few drops of blood or few drops of urine through the urethral opening. So generally, whenever a patient suffers from this condition, they have to visit a urologist's clinic or a urologist hospital so that the correct treatment can be started at the right time. When a patient comes to with this condition to the hospital, generally what we do is we do an ultrasound to see how much urine is there in the bladder. If it is a male patient, we also measure the size of the prostate gland, and we also measure whether there is any swelling in the kidneys, also called as hydronephrosis. If hydronephrosis is present, that means the pressure inside the bladder has built up to such an extent that it is getting transmitted into the kidneys also. And sometimes if required, we also send couple of blood tests to know whether there is any infective element and to know whether there is any chance of kidney failure associated with this retention of urine. And what we do as a first line of treatment is we put a small tube called as Foley's catheter through the urinary passage into the bladder. So this tube is gently inserted after putting lignocaine jelly, and once the tube reaches the bladder, the urine starts getting emptied from the bladder through the catheter into a urine bag. And immediately the patient will feel relief of symptoms, the swelling will come down, the pain will settle down, and then the catheter will be secured in such a way that it doesn't come out of the patient's body. Now, suppose in some cases, if the catheter fails to go, if there is a fixed blockage called as urethral stricture in the urinary passage, then the catheter can't reach up to the bladder. In such conditions, what we do is we make a small cut around 2 inches below the navel, and through that cut we insert the catheter into the bladder so that the same purpose is achieved, that is emptying of the urine. This is the immediate management. Now, suppose if after this, what is the next step? So we try to find out why exactly is this patient having this retention of urine. Many times it could be in male patients, elderly males, it could be because of enlargement of the prostate gland. So prostate gland gets enlarged and it blocks the urinary passage, so the patient fails to pass urine. Initially, before this episode of retention, patient would have had some symptoms related to BPH from past few months or years, and now he has reached a point where the urine has absolutely stopped coming out. This is one reason. Second reason is there could be a mechanical blockage in the passage of urine. It is called as urethral stricture. This can be seen in any age. It can be seen in younger men or it can be seen in elderly men. Rarely it can be seen even in women also. In this condition also, catheter cannot be passed and the patient has to be, urinary retention has to be treated through a suprapubic catheterization. So this is the correct investigation to diagnose this condition is retrograde ureterogram and micturating cystogram. So by doing this test, this is a type of X-ray, and by doing this X-ray, we will be able to find out where exactly is this blocked segment and how to treat it. So this is the second cause. Third cause is sometimes there could be neurological causes, like the patient might be having some issues related to his spinal cord or some nervous system related issues which will weaken the bladder. And because the bladder muscles are not getting enough strength to contract and push the urine out, patient may have retention of urine. So in those cases in which this neurologic cause is suspected, we usually perform a test called as urodynamic study to find out whether the detrusor muscles are having any strength, what is the level of activity of the detrusor muscles, and what is the level of resistance at the level of the sphincters. So based on this, the appropriate treatment is decided. So definitive treatment for the retention of urine depends on the cause of the blockage. So if it is prostate related, then many times the patients will require surgical treatment. If it is a precipitated retention, means if the patient had some other problem, like the patient underwent some surgical treatment yesterday and today he is unable to pass urine, or the patient is admitted in ICU for some heart attack or some stroke or some other reason and now the patient is able to pass urine. There are some other factors which have contributed to the retention. In such cases, we wait to allow that precipitating factor to settle. We remove the catheter and we reassess the patient to see whether the patient is able to pass urine now or not. And if he is able to pass urine, then there is no need for treatment. If there is no precipitating factor, then definitely treatment is required. And in case of stricture urethra, usually there is no precipitating cause, it is a mechanical blockage. So depending on the cause, the treatment has to be decided. Sometimes it can be endoscopic treatment or sometimes open surgery can be required. Neurogenic causes, depending on the degree of detrusor function, some medicines can be given to relieve the outlet obstruction and to improve the detrusor function so that the patient can pass urine. If the neurological cause has not been addressed, then neurosurgical or neurological opinion might be required to treat the basic cause, and then this urinary issue can be addressed. So, this is in brief about retention of urine. Thank you.